So we're reporting today 1,045 deaths of Detroiters, up from 1,036 yesterday. That is only 9 more than yesterday, which is the smallest number we've seen in a long time. Part of that reflects that we did not get a bunch of old death certificates that the state had updated and turned in, and we've been talking about the effect that that has. So what that means in the chart, which to me is the best measure, again, you can see where we're continuing to go. 197 deaths in this city 4 weeks ago, 241 3 weeks ago, 265 2 weeks ago, 183 last week, and then 81 this week. The numbers are coming down extremely fast, and what we're doing is continuing to work. The number that keeps growing as we gather the data are the deaths in the nursing homes. We are now up to 233 nursing home residents and 3 staff people. Before this is over, we're going to find that 1/4 to 1/3 of all the deaths in the city occurred at the nursing homes or the senior living centers, and we are focusing so much of our energies right now in moving through those locations. And the fact that you're seeing the death rate come down as quickly as it is reflects in the job that Denise Fair and her team are doing in these nursing homes, getting them the resources that they need. The hospital beds empty. Yesterday I told you it was 700 vacant adult hospital beds and 100 ICU beds. Today that 700 number is now over 800. So the hospital beds in this city continue to be empty at a rate I've never seen in my life. And the healthcare systems have got to respond. We have some of the greatest healthcare systems in America. For 40 or 50 years, taking care of patients at the same time there was infectious disease was something they did every day. Our hospitals know exactly how to care for people while separating the infectious from the non-infectious. And so we had a 4-week period where they were swamped with a pandemic the likes of which we haven't seen in more than 100 years. I think the public can understand that their 4-week period was a once-in-a-century event. But our hospital systems, our healthcare systems, have to get back to explaining to the patients again that they run very sound systems and that you can go see your doctor, you can go into your hospital, and you can stay safe. And so I'm hoping next week we really start to see some messaging coming out of our healthcare systems as to how you can go back to your doctor, go back to your hospital, and be very comfortable that you are protected from COVID-19. Our fairgrounds yesterday hit a new high. We tested more than 1,000 people on the fairgrounds itself for the first time ever. In addition to that, we did another 250 tests in the Abbott labs, so our numbers continue to climb, and it's really encouraging to see the companies, including the auto companies, now starting to send their workers through the fairgrounds. You can see companies getting ready to reopen and wanting to make sure that all their employees are tested negative before they go back to work. And we will keep ramping it up, and if we need to add, if we need to do 1,500 a day, we'll do 1,500 a day. We're just going to keep right on going because this is going to be our key. The biggest concern I have is this weekend. I just got off the phone off of a conference call with all our precinct commanders of the Detroit Police Department, all of whom are continuing to report excellent cooperation from this community as far as gatherings. But we're going to have our first really good weekend, probably, weather-wise. And all of the good news that you see on that slide will be undone in a hurry if people go out in the parks, in the neighborhoods, and gather in large groups. The reason that this has come down is because we've honored the social distancing. Folks all over Detroit are wearing their masks. We brought this down at a rate probably faster than any city in the country because of that commitment. It will go up faster than any city in that country if we abandon that commitment. And so all of the police commanders I know are committed for very vigorous enforcement this weekend with any groups. And so I hope we won't have to do that. We are going to start cutting the parks because people in the city have been enjoying the parks appropriately. Small family groups, people walking in ones and twos in the parks across this city. We want you to enjoy the beautiful parks of the city of Detroit with social distancing, but we're prepared to act because we are not going to let this trend get reversed. And so that there's any confusion, I don't understand all the stuff that's going on in Lansing. What I do know is this: the governor has an executive order in place, and we will be enforcing that order until a court tells us otherwise. So I don't know anybody who thinks it's a good idea to reopen the bars or the restaurants or the barbershops or the casinos or let large crowds gather. I don't think the Republicans or the Democrats think that's a good idea. I think they're in a debate over a 1945 law versus a 1976 law. But in any event, there will be no confusion in the city of Detroit. We have an executive order from the governor. We will follow it until somebody gives us a court ruling that says we should not. I wanted to highlight today one of the public works projects that have been started. And on Monday, more than 400 Detroit employees are coming back to work to do roads and water and sewer and parks maintenance and the like. We're bringing them back in a safe manner. But we had one project that couldn't wait. And many of you will remember about this time last year in the Jefferson-Chalmers neighborhood. There was huge flooding as the river levels came over the seawalls throughout that area, and there was an enormous amount of damage that was done. We responded as we always do as a community. We had volunteers who put out 400,000 sandbags. I was out there with them. There was one lady who lived over at Plymouth and Southfield. She took 2 buses every day to get to the Jefferson-Chalmers neighborhood just to fill sandbags to help her fellow citizens on the east side of Detroit. Nobody paid her, nobody asked her. That was the way this community responded, and we saved a lot of the homes. But putting down 400,000 sandbags in the middle of a flooding is not what you want to do. And while we were again at a 100-year water level, we're seeing this pattern in a lot of different ways right now. The Army Corps of Engineers who worked with us told us you can expect it to be even higher next year. And we said this time we're not going to scramble. And so I have with me today Palencia Mobley, the Deputy Director of the Detroit Water and Sewer Department and the Chief Engineer, and Crystal Perkins, the Project Manager for the General Services Department. And after consulting with the Army Corps of Engineers, we came up with a plan known as a Tiger Dam that Palencia Mobley is about to show you. And it was about a $3 million project. We had to bring 28 city employees back on April 10th. We put them out in masks. We take their temperature every day. We're following our protocols. But they couldn't wait until the pandemic was over. If they had, we'd have lost a lot of homes in Jefferson-Chalmers to flooding. And so these fine public servants have been out there since April 10th. I think they'll be done by the middle of May with really the only solution. It isn't the most aesthetically pleasing solution to have a big orange tube, but it beats flooded basements, which is what we were dealing with last year. It is remarkable how calmly, efficiently, and without drama they have been executing this. And they reflect the kind of employees we have in the city of Detroit, who in the middle of a pandemic, a health crisis, can calmly go out and keep our neighbors free of a flooding crisis. And so with that, I'm going to turn it over to Palencia Mobley to show you what's been being done the last 4 weeks on the east side of Detroit. Palencia?
Thank you, Mayor. So last spring, we had unprecedented Great Lakes and Detroit River levels, which caused water to rise over seawalls, which also caused flooding basements as well as flooded streets. Now we're implementing a new technology that multiple cities are using that border waterways. We spent $3 million to install a temporary dam that will reduce the impact of rising water along the Detroit River and canal seawalls on the Lower East Side. The dam will also protect our wet weather treatment facilities, which serve the east side of Detroit and some suburban communities. Last year, nearly 7 billion gallons of river and storm water flowed into this wet weather treatment facility. The pumps are not designed to work 24 hours on multiple days of the week. The tubes are filled with water, and each tube is linked together seamlessly. Each tube weighs about 6,300 pounds when completely filled. The effort that the city is taking on is a preventative measure. Climate experts have let us know that the Great Lakes water levels will continue to rise and will surpass last year. We are expected to have a 4-inch rise that is greater than it was last year. Our installation is being done by the City of Detroit crews along with the Army Corps of Engineers and various subcontractors. Our installation began in April, and it will be completed later this month.
And so it's pretty remarkable. The Jefferson Chalmers neighborhood may not be well known, but absolutely beautiful homes along the waterfront. And I know when I was campaigning there in 2013, people said, nobody remembers us down here. It is a great neighborhood. And last spring and summer, when people poured in across the city to fill the sandbags, I think that neighborhood knew the city did care, and now we are getting ahead of this. And so last year we had a 100-year high sea level, or water level, and Great Lakes sea level. This year they say it'll be 4 inches higher than that, but instead of scrambling, we're getting ahead of the curve. We are going to stay with these tiger dams as a measure until we can build out permanent seawalls, which is a very complicated legal issue and is going to involve the Army Corps. It's going to involve the people who live along the water actually making sure their own seawalls are properly constructed. But we'll figure that out over the next year or two. At least right now, we believe that we have given this neighborhood significant protection from losing their homes. So Palencia, Crystal, and your team, I just want to say thank you for what you've done. And with that, we're going to turn it over to Denise Farrow, who's going to tell you what she's doing to make sure every senior citizen in this city is protected.
Thank you, and we're doing quite a lot, Mayor. So let me just share with those who are watching where we are with our target of testing all 37 long-term facilities, long-term care facilities that have confirmed COVID-19 cases. So again, our goal was to test all of them by May 15th. This morning, the team tested 4 more sites, which brings us to a total of 10 facilities tested thus far. And next week, we'll share with you some of our preliminary results. These facilities are key to helping us manage COVID-19 because these are congregate settings. As of today, there are 9,192 COVID-19 cases and 1,045 deaths. Every day it saddens me when I share these results and these statistics, and my heart always grieves for those families that are experiencing this loss. As the mayor alluded to yesterday, we cannot allow COVID-19 to cause us to neglect other vital healthcare concerns that we may have, and so residents with chronic conditions should continue to follow guidelines for medications and exercise as directed by their doctors, and no one should forego necessary appointments or not seek medical attention for their emergencies. I also wanted to jump back because I didn't finish my my update, but nursing homes is still a priority for all of the staff to be tested. So again, there's 26 in the city of Detroit, and now all 26 of them have registered their staff to be tested. Again, it's so important for the staff, and so we'll make sure that we report next week on what the results are. And so with that, I'll turn it over to the mayor.
All right, any questions?
Hello, Eli Newman, WDET, Public Radio in Detroit. Regarding the Tiger dams, so I think we discussed that it was a currently temporary measure for what we'll see with the Great Lakes and increasing water levels there. What are those permanent measures that are being considered right now, and what are those legal challenges that we're seeing?
We're working through that with the Army Corps, and you know there are huge constructions that could be built out in the river. There are major improvements homeowners can do to their own seawalls, which can be done through a series of enforcements. Were it not for a pandemic, we might have been farther along, but I think we made a really good judgment just to say we're going to protect people from flooding this year. My guess is we will be using the Tiger dams again next spring. Now, either the water levels go down and the problem is solved, or Ms. Mobley and the team will work with the Army Corps on a permanent solution. And I don't know, Palencia, if you have any idea how long that might be.
So I think it would take a few years to really determine the most appropriate solution. And as the mayor stated, there are multiple legal challenges. So there are private property owners that could improve their seawalls, but there are also things that could be placed into the canals or the rivers, as he stated. So that would take some time to design and then install based on overcoming those legal challenges.
Sure, and beyond like the seawall issue, is the city considering looking at some of the older sewer lines that are in the area?
So most of the Jefferson Chalmers area is what we call below sea level. So the river is actually higher than the ground in various parts of that neighborhood. So use of the existing sewer infrastructure is pretty much maximized during any wet weather event. So trying to now use some of that to contain river water would be a challenge.
So if I can try that in language maybe that I would understand better, which is the sewer system down in Jefferson Chalmers is just fine for normal rainstorms. It's not fine for the entire Detroit River pouring into the street. It was never designed for that. So it's not that there's a problem with the storm sewer system. It's a problem that you can never accommodate an overflowed river. And we're just going to stop it. But I think the system has done just fine. And last year, Gary Brown and DWSD went out and unclogged every one of those storm drains with the Vector trucks. They cleared up everything that could be cleared up by the water and sewer system. It's just now a function of making sure flooding doesn't come from the river.
Sure. And for Ms. Fair, I'm wondering, as the health department has been looking at long-term care facilities, what differences they're noticing between what we've seen in the nursing homes, and why at least currently it doesn't seem like it is as big of an issue there as we're seeing at in the LTC.
Yeah, so I think it's too early to tell. We literally just started on Wednesday. We'll have preliminary results available on Monday so that we can compare. What we found in nursing homes is that the infection rate is about 24%. So I can't give you the results right now, but Monday we should have a better response.
Sure. And Mayor Duggan, I was also wondering about, you were saying that the DPD has seen a lot of cooperation with order compliance. I mean, has there been, in terms of citations issued, is that down from where we were, a
They
couple
were, in
weeks ago?
fact, AC White told me, what did he tell me, 19 yesterday? The smallest number they have written so far, DPD wrote yesterday in citations. And the challenge is going to be this weekend if we have the nice weather predicted. But we're getting good cooperation, and we're seeing the same thing. As soon as groups start to gather, neighbors are calling because they're trying to protect the health of this community. And I think as the community started to understand that, we've seen fewer and fewer gatherings. Doesn't mean they don't happen. What it does mean, when they happen, you can be pretty sure the police car is going to be there in a matter of a few minutes.
Sure. And yesterday you had mentioned that Fire Department Commissioner Eric Jones had noticed an increase in the amount of people found dead on site when reporting to 911 calls.
Right.
So what is normal for EMS to report to, and what does it look like now?
I'm not going to give you the numbers off the top of my head, but they are up. They have been up for a couple of months now, and the fire department has those numbers. We could get them for you, and We haven't done enough of a health analysis to tell you for sure, but I think there is a good likelihood that a number of them were probably COVID-19 related, and I think a good number of them were probably people who had chronic underlying conditions who avoided the doctors or the hospitals because they were fearful of COVID-19. How much is each category? I'm sure Ms. Fair in the coming months will analyze, but there is an increase in the number of deaths on site in the last couple months than we had seen last year at this time.
So in terms of that analysis, are you instructing county coroners to be studying those bodies?
County coroner doesn't work for me, so
Okay.
I don't have any right to instruct or anything, but the coroners follow the law, and every case is handled according to the law.
Thank you.
Mayor, we have a question from J.C. Reinl from the Detroit Free Press. Wants to know, with the current timeline for reactivating certain medical services of being May 28th right now, do you know if there's any consideration being given at the state level to maybe give an exemption to certain outpatient surgery facilities, et cetera?
You know, I think Dr. Khaldun should speak to that, and we had a conversation yesterday, and she pointed out to me, you have some hospital systems like Henry Ford who are scheduling a lot of activities that she felt were entirely consistent with the order. And so, but as far as what they're going to do, whether they clarify the existing order, whether they modify the order, whether the order is fine as is, I think you should direct that question to Dr. Khaldun when the governor does a briefing.
Okay. And ML Elric from the Free Press just wanted to know if we expect the police department's going to have additional staffing out this weekend.
We are fully staffed at the police department, so we've had more than 1,000 officers return to work. At this point, I think 2/3 of all the officers in the police department have been through our 15-minute testing. So they are fully staffed, and we will be staffed at the same level we would have been last May, and that does include supplemental patrols in the parks.
Okay. I think that was the last question for today.
All right, thank you all very much.
怎么又晚了？
这诊所太远了，这里多开几间就好了。
政府里需要有我们的人，需求才会被听到。
哎，你这……哎，你们两个都对，可光说有什么用啊？填好2020年的人口普查，就可以协助公共资金的分配，比如地方医疗、更多的政府席位。想要给自己发声啊，赶紧上网填，打电话也行。
请上2020census.gov 完成普查。